Welcome to welcome to our Health Council Talks today. It's a Health Council Talks, but also an advocacy training for health councils. And in preparation for the legislative session, we wanted to bring in Joseph Hill today. And so his topic is going to be around policy-based strategies. And if you are a CHICA grant recipient, you may have already attended this training, but we thought it would be so awesome to have this available for other health councils who are not part of CHICA. And so feel free to stay on, because at the end, Val, our executive director, will be giving an update on the Health Council funding and the legislative session. And so, yeah, very informative session today. And I'll go ahead and kick it off to Joseph now.
Well, hello, everybody. Happy Friday. I'm going to go ahead and share my screen, and hopefully you will see the right thing. Let's get that going. Let's see. I believe I share first. Then we will share here. Okay, do you see the presentation or the notes?
The presentation, so you're good.
Yes. I've gotten that right each time the last few times. I'm very proud of myself. Okay, so yes, as was stated before, I gave this presentation to a group of health councils earlier. They asked me to do it again, so I guess it went okay. I'm going to do it a little different. I had about an hour and a half last time. So I'm going to try to fit this in about 50 minutes, 45 minutes. So this is just going to be me talking very fast. I also just got off of an airplane from 2 time zones away about 14 hours ago. So if I sound weird, that's what's going on. Just don't judge me. I'm a completely normal person, and I'm great in every way. Almost perfect. So my name is Joseph Hill. I'm the Director of Education and Community Engagement at the Public Health Institute, which is the Center for Health Innovation. I have a clergy background, so I come to this work having worked directly in communities with various populations, such as youth, those experiencing houselessness, recovery communities, and I would help families navigate the various systems that people are subject to, whether it be the criminal justice system, the healthcare system, the academic system, and various social services. My educational background, I have degrees in ministry, business, and human services. I was a rural and frontier health advocate for about a decade. I've got a quarter century of community engagement experience from multiple different angles, from all the way from volunteer to fiscal agent. Here are just some recent things, just to give a background of the various advocacy efforts I've been in and what it can look like for me. Apparently I also wear blue a lot, which I didn't realize until I put this graphic together months ago. But anyways, I look good in blue, so we've established this. On the top left hand, you can see I'm there where I'm there with a group called NM Cafe, and we are protesting detention centers, but I also do very local things. You see me there in the middle with the superintendent of a local school district. Down at the bottom left, I'm speaking to several state legislators about how their resources are being unequally distributed around rural areas and frontier areas. In the middle there, you see me there where I look like I have no clue what to do with my hands. I'm there with our former federal senator, and then I'm there with a representative, a former representative of a region. And what I'm here to talk to you about is really what brings all of those together in a lot of ways. What I'm here talking to you about can work on a larger level or a smaller level. If I had more time, I'd talk about the difference between small P policies and big P policies. But the main thing is to understand and realize, and this is why I enjoy spending time with groups such as yourselves, because I think we all understand this concept. This is my favorite quote. I say it often to myself. I say it to any group of people I can see. And it's never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has, and that is from the famous anthropologist Margaret Mead. Check her out. She's cool. This is what I want to accomplish today. I want to walk away with an understanding the difference between lobbying and advocacy. Those are very related things, but they are different. And then just an introduction to key advocacy strategies. Strategies that won't get you in trouble. This is the thing I have to skip because I don't have the time for it. Let's talk about policy work. And I want to throw a few definitions at you. One is policy practice. Policy practice are efforts to change policies in legislative, agency, and community settings by establishing new policies, improving existing ones, or defeating the policy initiatives of other people. Policy advocacy is policy practice aimed at helping powerless, vulnerable populations, improving their living situations, access to resources, and increasing their opportunities. And advocacy is the act of engaging with government officials to educate and provide technical, factual, and nonpartisan information about relevant issues. So these are the things that we're focusing on. However, as I mentioned before, it's important to parse out the difference between advocacy and lobbying because they're sometimes used interchangeably, but they are different. Advocacy is a general term that can simply be supporting a cause or speaking up for something that you believe in. There is no legal definition used for advocacy. However, if an organization uses any funding for advocacy purposes, this must be reported to the IRS. We're going to talk more about that later. There are different designations as nonprofits where one can be involved in various political activities in various ways. But political activity involves campaigning for a particular party or candidate and is not allowed in a 501c3 nonprofit organization. There are ways around that, but I'm not the person to tell you all of that. If a health council receives any federal or state funding, and often a lot of state funding can be federal funding in some cases, then the council must be careful not to use any of the funds to impact specific legislation in certain ways. So understanding how lobbying rules impact the council's work is very essential. Lobbying, and let's define this, is a form of policy advocacy. However, for legal reasons, we need to make the distinction between advocacy, lobbying, and political activity. The Center for Lobbying in the Public Interest defines lobbying as attempts to influence specific legislation through direct or grassroots communication with legislators or their staff. Lobbying involves advocacy, but advocacy doesn't always involve lobbying. A distinction is also made between lobbying and grassroots lobbying. Grassroots lobbying is appealing to the general public to contact the legislator about a specific issue. Lobbying, or also known as direct lobbying, refers to directly contacting government officials or staff to influence legislation. Appeals to the public related to a proposition, for instance, vote no or yes on proposition A, B, or C, a ballot initiative or referendum are considered direct lobbying. It's important to make a distinction due to laws. There's the 1976 lobbying law and the 1990 IRS laws related to direct lobbying. The federal government supports nonprofit organizations lobbying, and under the 1976 lobbying laws, has specific conditions in which lobbying can occur. So if you don't know what those specific conditions are, you got to be really careful there. Now, this is the most exciting part of this. I'm just going to read you some tax law. The reason why I'm going to read you tax law is because I'm not a lawyer. However, I'm going to assume the people that wrote this understand the law. So I'm going to read it to you as the law. These are the things that are unallowable in our context generally. Attempts to influence the outcome of any federal, state, or local election, referendum, initiative, or similar procedure through in-kind or cash contributions, endorsements, publicity, or similar activity. Establishing, administering, contributing to, or paying the expenses of a political party, campaign, political action committee, or other organizations established for the purpose of influencing the outcomes of elections. Any attempt to influence, like the introduction of federal or state legislation, or the enactment or modification of any pending federal or state legislation through communication with any member or employee of Congress or state legislator, including efforts to influence state or local officials to engage in similar lobbying activity, or with any government official or employee in connection with a decision to sign or veto enrolled legislation. Any attempt to influence the introduction of federal and state legislation, the impact or the enactment or modification of any pending federal or state legislation by preparing, distributing, or using publicity or propaganda, or any segment thereof. How often do you use the word thereof? Okay, thereof, to contribute to or participate in any mass demonstration, march, rally, fundraising drive, lobbying, campaign, or letter writing or telephone campaign. Or legislative liaison activities, including attendance at legislative sessions or committee hearings, gathering information regarding legislation, and analyzing the effect of legislation when such activities are carried on in support of and knowing preparation for an effort to engage in unallowable lobbying. Whew. Okay. So that seemed like everything, didn't it? When I read it to you. So the question is, what are we able to do? And it's really important to understand the distinctions, because a lot of times it can look very similar, but they are actually different things. So here are some examples of activities that are not considered lobbying. One, meeting with the legislator to talk about a social problem without mentioning a specific legislative proposal, right? Now, if it comes up, if they bring it up, well, but you aren't bringing it up. You're just talking about it. You're letting them know, hey, what things can look like in your community, and you are providing context to help them make the decisions that they need to make. Providing a legislator with educational materials about a specific piece of legislation without calling for specific action on the legislation. For instance, you can give them all the information of why it would be a bad idea to do something without saying, don't do this. Or you can give them all the information of, hey, this is all of the positive things that will take place for your constituency, but you aren't telling them, but you need to do this. Responding to a request from a legislative committee or a subcommittee for information about a specific piece of legislation. So often you can show up and actually present. Maybe you can present to a specific committee that's meeting over a specific issue, maybe even the finance committee, but you can actually testify as to why something can be a positive thing for your community. Publishing and distributing a newsletter to your own membership, providing information about a specific piece of legislation, your organization's position on the legislation, and the names of the legislator who support and oppose this legislation. But again, you'll see a theme here, not a specific call to action, like a request to call or write legislators. There are ways you can do that, but you can't do it formally as the specific entity that's receiving the federal funding. Tracking activities of legislators, including votes, positions taken, and contributions accepted. Producing and disseminating research reports or studies to provide a nonpartisan analysis on a policy issue, including specific legislative issues, talking to the media about specific legislative proposals, advocating for better enforcement of existing laws. The ones, and the example I use here is, if you were working on substance misuse prevention, there are already laws that control alcohol sales to minors. But maybe in certain cases, certain areas, maybe this can be a regional issue with some of you. Maybe it isn't enforced as well as it should be. And so just making sure that people are paying attention to that. Advocating for enacting and enforcing private or voluntary policies. For instance, let's stick with the same issue. If I wanted to go to a private business, which might be a stadium, and say, hey, can you restrict your alcohol sales in your stadium? Or maybe a local government. And this is something that I've been involved in and have seen successful of, hey, maybe at a certain time of the day, alcohol can't be at a park. Or if there's a specific event that's aimed towards families, maybe in your parks, alcohol can't be there or it can't be served. Conducting public education campaigns to affect the general public's opinion, like a mass media educational campaign about the importance of not providing alcohol to minors. Again, these are different ways of advocating that aren't considered lobbying. Now, what if you do want to lobby? Well, that doesn't necessarily mean that you can't lobby. It just means that you can't lobby if you are exactly a 501c3. For instance, there are 30 different nonprofit classification codes, 501c3, 501c4, and so on and so forth. There's 527. I don't exactly know what all of them do. I know what some of them do. There's a whole lot of them. A classification for nonprofits is awarded based on that organization's purpose. I've started a few nonprofits. I've assisted others in starting nonprofits. One of the things that you have to be very clear for in the beginning is what exactly you're beginning this entity to do. Some nonprofits are created for the sole purpose of advocacy and lobbying, and those follow a different set of rules than others. So for instance, a 501c4 can do some of those things. Now, I've seen organizations that may have a similar board, they may share the same space, maybe even share some staff, and they might be a 50c13 or 501c3, and then they might also have another designation. I am not an expert in that by any means. Please seek out legal counsel when you are looking into something such as that. But there's an option. And then there's a whole nother perspective. Notice when I said that I was protesting the inhumane conditions at some detention centers, I didn't show up representing any type of health council or anything like that. I showed up with a completely different agency, and I have done so with many other advocacy efforts. And this is why, because as a private citizen, I can both lobby and practice advocacy. Becoming familiar with the legislative system is a good idea, especially for those in public health, mainly because our politicians affect so many things for the communities that we're trying to serve. You can also raise money as a private citizen, or what I call the cookie sale or enchilada sale method, depending on how close you are to the border. We have a lot of enchiladas down here. I'm down here in the South, and I am here for it. I'm here for all the enchiladas, red and green, no discrimination. So you can raise private money, for instance, and hey, maybe you want to go up with people that happen to be in your health council, but you raise private money and you fund that trip with your private money that you raised with your enchilada sales. You just happen to understand a certain perspective of an issue. If you go up as a private citizen who happens to also represent other things, but you're showing up in the capacity of a private citizen, you can do all the lobbying you want. So that is me condensing an hour and a half into about 20 minutes. I'm actually very impressed with myself right now. Hopefully it wasn't so fast that it didn't make any sense. So I also acknowledge that there's probably a lot of wisdom in this room. So not only do I want to open up for questions, but also discussion. If somebody has any extra insight into some of the concepts that I've brought up, this could be a good time to discuss it for the good of the group.
Any questions or any comments from health councils?
Thanks, Geraldine. Thank you, Mr. Hill. This is Anna Horner, and I am here today with the Health Equity Council, which is the Bernalillo Health Council. And yeah, there was a lot of information in there. I really appreciated it. And I'm thinking about just kind of what we're all supporting right now, the undertaking of kind of the advocacy work to bring funding to health councils and how that fits in. I'm not sure how familiar you are with that, with those endeavors. But my understanding is that health councils did, someone correct me because I don't know all the details, but with the CDC funding, and I think the first question would be, is that federal funding, is that's distributed through the state? Is that state funding? And then how does that, the classification of those funds, how does that influence the capacity of the health councils to be doing advocacy? Because some of the things that I saw on your don't do list, I don't know if I should be doing them or shouldn't be doing them based on this presentation. And I think that would be really helpful to get some insight. So specifically asking people to send letters and contact their electeds around a specific piece of legislation. That, I mean, the legislation hasn't been given a number yet, as far as I know, or a specific name. So maybe it is, maybe we're walking a fine line, or we're sort of in a gray area. But those are just sort of immediate questions that apply to the work that we're doing, and how it fits into all the right information that you shared. Thanks.
Yeah, so I'm very familiar with the work and have engaged at it and in it in multiple points over the years. I think the key thing is to understand that you can pretty much ask anything. You just have to be a different person sometimes. All of us here wear multiple hats, right? Now, I actually come from a health council background as well. I coordinated a health council for about 5 years. And, you know, sometimes we would discuss certain things that were going on at a legislative level and decide to end our meeting 15 minutes early. So, and if the private citizens just after we ended our meeting so happened to need to make a phone call, and that so happened to be to a legislator, I mean, hey, private citizens can do what private citizens needed to do. But on our agenda, we displayed what time we ended, and that was not on the agenda. In that case, we were in the same room, we were the same people, but we switched hats, right? So it's not necessarily that you can't do a lot of those things. It's that you can't do those things as they are funded by federal funding, if that makes sense. And that's, you know, for I'll give you an example. If you were there to do lobbying, you can. Oh, I see Susan's hand up. I bet Susan would have a better example than I do.
No, go ahead, Joseph. Give your example, and then I'll follow after you.
Oh man, I thought Susan was going to rescue me. If you were to go up with, if you were to use health council funding to drive up and to do some lobbying, that is a no-no. If you were to hold a bake sale and go up with people that you happen to be on the health council with to go up and do lobbying, that's not an issue. If you were to use health council funding to do education, though, that's not an issue either. And mind you, education, what people call advocacy and what people can call lobbying is often conflated, right? But it depends on the direction you're coming from, right? If you're showing up educating and you aren't saying vote this specific way, but your education is so obvious that it does indicate something and you don't actually say the word, that is completely fine. I don't know if that answers your question, but that's my answer.
Yeah. And Anna, that's an excellent question. And I think it's on the minds of a lot of health councils. And I know with Val's presentation, she'll be elaborating on it. But one of the main questions we get asked as the Alliance goes around throughout the state, especially by elected officials, is what is a health council? And what do they do? What is their impact? And that's where we're asking health councils to reach out and educate their elected officials. So at this point in time, what Joseph is saying is true. You're really educating decision makers based on some of the questions that they ask of health councils and the Alliance. So for you to reach out to your representative or senator and say, hey, have you heard about our health council? Let me tell you what we do. Let me tell you our impact that we're having. Let me tell you how we got established, that we're codified. Our partnerships that we've developed over the years. I think that's part of that advocacy work that we are encouraging. And I'll defer the letter of support question over to Val.
Thank you, Susan and Joseph and everyone for being here. Really appreciate everyone's presence, time, and energy today. If I can hear the question about the support letter, because I just landed in the space. I was in a different meeting, so.
Thanks. Here comes Anna.
Yes, hello, good afternoon, Valeria, nice to see you.
Nice to see you.
Yeah, just based on Joseph's presentation, I was asking questions around, just understanding the source of the CDC funding, if it's federal funding or state funding, and then some of the information that was being shared, the restriction from using any of that kind of funded work to advocate for specific or lobby for specific legislation, and how that fits in with the call for the health councils to be gathering, asking people to sign letters of support specific to an upcoming funding bill that sounds specific. So I'm just trying to figure out how to kind of reconcile the work that we're doing with what we just heard in the presentation.
Absolutely. Great question, Anna. And I would echo both Joseph and Susan. What we get to do both at the Alliance and in the power of numbers here with our health councils is to engage, educate, and enlist. Engage, educate, and enlist. The more our elected officials, and also including the governor, the more our government understands the instrumental role of our health council statewide, both at the local community-based trusted health hubs and within the infrastructure itself, and how critical they are at both the micro and the macrocosm. That's been part of our value proposition as we've been advocating in various spaces on behalf of health councils. So just remember the 3 E's: engage, educate, and enlist. And the latter, when you know you've enlisted somebody, they're starting to advocate on your behalf. Example, Geraldine, myself, Debbie met with Director Salih and educated him on all the amazing work of our health councils, the partnership with DOH, so on and so forth. When budget proposals were submitted, he was the first to call, take time out of his busy day and say, hey, Val, here are my findings. Hey, Val, here's what I'm learning. Hey, Val, you might want to call so-and-so. So the fact that, he took the time, to circle back with us, and we're staying in constant communication, and that engagement is not a one-time effort, is an ongoing effort and relationship builder. Because it's not just this legislative session, it's, the next as well, and so on and so forth. So that would be my, and that's the direction of the team internally, and enlisting our health councils to follow that same pathway of engaging, educating, and enlisting. Yeah, and the focus areas are legislative finance committee, Senate finance, House appropriations, and the governor's office. Go ahead, Susan.
Oh, I just wanted to add 2 really brief points. The letter of support is just that. It's a letter of support. So we consider that educational. Yes. We're educating and showing our support that here's what health councils are. This is what they do. This is their impact. And people signing on to that are basically saying, we would love your support of health councils. As my rule, my general rule, and I've been doing this for a long time, is as soon as a piece of legislation has a bill number, that's where you have to be very cautious. So if you were to say, Senator so-and-so or Representative so-and-so, please support, Senate Bill X or House Bill X, that's where you're really beginning to cross that line into lobbying, because it is a specific piece of legislation, and you cannot do that through federal funding. So if you're doing that on time that you're billing to your CDC Kellogg grant, no federal grants allow lobbying. So if you lobby, you need to be billing your time to a funding source which will allow for that, if that makes sense. But federal funds almost exclusively will not allow any kind of lobbying. And some foundations, you just have to read your foundation funding requirements. A lot of foundations may not require certain types of lobbying. Some do. So it depends with foundation funding. State funding generally will not allow lobbying. But then any kind of fee-for-service revenue, other types of unrestricted revenue, you could actually, as a 501c3, do limited lobbying.
Thank you, Susan. Geraldine, is this a good time to provide a little advocacy update? And
yes, I don't see any additional questions or comments in the chat. We want to give a quick second and then we can transition. Yeah, nothing's popping up in chat. So I think this is a good time to transition for the Health Council update.
Oh, for the Health Council update or advocacy update?
Apologies, the advocacy update.
I didn't want to take up room if we needed our help, if we had the Health Councils and updates on our agenda. Okay, great, my friends. Thank you again for being here. I'm going to do a quick screen share and also, present. Let me look. So this is been part of, how do I do this? Here it is. Been part of our quarterly, bi-monthly updates to the board as well, advocacy fundraising. I see, Geraldine, would you help me keep an eye on the chat? Oh, yes, thank you. Thank you, Joseph, so much. Absolutely. So to the point here, our strategy and systems advocacy, because this public health infrastructure, this mechanism of health council statewide is a systems advocacy strategy. So again, engaging, educating, enlisting with a compelling, clear, concise, and consistent messaging. And that's something that health councils you'll see, and also our partners, you'll see some of our branding messaging coming in the upcoming months, so that we're all visually and in terms of our messaging saying the same thing together over and over and over and over again out to the public, and as we enlist legislators, right? So we have essentially 5 strategies that we have been driving since the end of the last session. 1, working closely with NMDOH and including replacement funding for health councils, minimum of $3 million. So that replacement funding from CDC at $50K, that goes away in May, right? However, in recent updates, that is no longer a viable avenue. I am also, from a place of total curiosity, seeking to understand what is the legal viability of state statutes. So that's something I'm exploring. Number 2, the funding bill. As we've heard, our amazing co-sponsors, Representative Anthony Allison, Representative Liz Thompson, Johnson, and Senator Stefanik are driving the funding bill. I got an update this morning that the open request has been completed, and that the funding bill will be pre-filed January 2nd. So that's very, very exciting. Geraldine, the team, myself, we've been working diligently during the interim session, presenting at Legislative Health and Human Services, Indian Affairs, submitted several requests to LFC to present. Wasn't possible, but we have literally been scheduling individual sessions with the chair and vice chair of Legislative Finance Committee, of Senate Finance, of House Appropriation, and members of each of these 3 to enlist their support for the funding bill for health councils coming into the new session. Also enlisting support for our co-sponsors to make sure that that funding bill gets obviously introduced in the House, the Senate, and included on House Bill 2. And 3rd, enlisting the governor. And of course, the support letters is one avenue, requesting a meeting with her is another, also through our partners to meet with her, to speak to the critical work of health councils, partnership with DOH, and how we're driving health outcomes in New Mexico post-COVID, during and post-COVID. We've also been working, and I think it's important to emphasize fundraising here, because in my 30-year career in the nonprofit sector, it's been an easy ride of raising funds for nonprofits. Okay, what is unique to health councils and the pushback that I've been receiving, and Geraldine's been part of those conversations, I've got to witness. The feedback we've been receiving for both national and state foundations and high-end donors is the following. Val, it is amazing to learn about the work of health councils, individual high-end donors. Val, we know the work that health councils are doing statewide, particularly during COVID and currently from foundations. The pushback is, this is a function of public health. It is state mandate. Therefore, the government is responsible for ensuring the operation of this critical mechanism we call county and tribal health councils. It is stipulated in HB 137. So foundations also have expressed that the reason why they may have given health councils, NMHC, and organizations alike a lifeline during the last 3 years is because of the unique circumstances we were facing with a public health crisis called a worldwide pandemic, COVID-19. That is not something that they do. We are also exploring federal grants, and congressional grants, and junior funds if they're available, although we were told that they're not going to be available this upcoming session, but you never know, maybe something changes. So that's just the realities with philanthropy and high-end donors. Of course, we're also working through corporate sponsorship. There's an opportunity with Sandia Casino and others, but those conversations, they want to have them in January, February. So there could be a potential there for a lifeline. When I say a lifeline, a minimum of $1 million to $3 million to keep our health councils and NMHC going for beyond May 2024. Fourth strategy is advocacy partners. Of course, central partnerships here are with our health councils and public health partners and our board. So the more that we are unified in our advocacy efforts to engage, educate, and enlist elected officials in support of this funding bill, the better. We had a big win yesterday with the All Pueblo Council of Governors. Geraldine, please share, my dear.
Yes, will do. So if you're not familiar with APCG, that just stands for the All Pueblo Council of Governors. And so they're a network of all the Pueblo governors in New Mexico, including the lieutenant governors. And so they meet once a month. And we've been able to meet with them for the past 4 months, talking about tribal health councils, but the support for health councils in general, both county and tribal, and enlisting their support. So the good news is yesterday, they finally passed a resolution to support funding for county and tribal health councils. And they look forward to expanding partnerships with the Pueblos specifically, and hoping that we can develop some more health councils with our fellow Pueblos. So really awesome that the resolution was passed, and we look forward to continuing our partnership with APCG. The tribal governors from the Pueblos were really looking forward to updates in the future around tribal health councils specifically, and some of the work in progress they've been making. But we have also been able to share some of the work they have been doing for the past 3 years under the CDC grant and some of the other amazing things that they're doing. So yes, yeah, really happy and thrilled to share that.
And then President Nygren.
Yes. And so switching to the Navajo Nation, I got a call yesterday from Mr. Boo Nygren. He's the Navajo Nation president. So we have been in contact with him for quite some time. He's interested in developing health councils on the Navajo Nation, but what that would look like right now is definitely still in the air. And we're just going to discuss what that would look like because it covers 3 states, right? And there's so many chapter houses, and I guess planning that would be something for us to discuss in the future. But in addition to that, he also supported our House bill last year, and he wants to also support us this year, writing a letter of support to the governor. And so I'm going to send him a sample letter today and see if we can set up some one-on-one meeting with him and his staff. So we are making some little strides, not little, big strides with our Pueblo leadership and also the Navajo Nation leadership as well.
Thank you, Geraldine. So just to emphasize, these efforts have been ongoing since January. We have not stopped our advocacy efforts. We've gone into continue to be in full gear, all hands on deck, exploring every possible avenue to advocate on behalf of our health councils. Children's New Mexico Voice, Children's Voice, I probably messed that up, apologies. We're going to be writing co-authoring an op-ed about the critical work of health councils, and really at the intersection of so many public health priorities, social determinants of health, and the list goes on. So it's so great we've always had their support, of course, as well as the Alcohol Harms Alleviation Coalition, working with them to explore partnership to explore what kind of funding opportunities are available particularly for next year. In conversation with the office of okay, let me pause right here. Many other avenues. In the 5th strategy is that there are funding sources in other state agencies that we're seeking to explore, because again, health councils are at the intersection of public health in so many ways, social determinants of health. So we've been reaching out to the Attorney General's office, first of all, to understand how opioid settlement funds are being allocated at the county level to address opioid and fentanyl and mental and behavioral health and all of that. and see if there's an opportunity to allocate minimum of $3 million for our health councils, because that's a lot of the work that a lot of you are doing directly, direct services out in communities, working with enlisting health human services division, cabinet secretary there, to explore rural primary care and see if there's an opportunity to invest in health councils statewide, given the work that you all do with ensuring access to primary care. New Mexico agriculture, exploring funding opportunities there, as well as with Indian affairs. There's a lot more to unpack. This is high level, but I wanted to let you know the 5 different advocacy fundraising pathways that this little team, but mighty team, have been advocating and exploring. Geraldine, I think there's some questions here, maybe.
No questions, Val. Just someone had to hop off.
Okay. And just to give us an overview of our high-level ecosystem of partners, of course, our health councils, our board, our elected officials, our public health partners, the media, and then the various avenues in which we can engage. Our approach with advocacy is an awareness campaign. Again, engaging, educating, and enlisting. It's about bringing awareness as to who health councils are, their instrumental role, and the impact, so that they feel inspired to then obviously advocate on our behalf. We're happy to share these slides with all of you. This is some of the various headways we've even made this week. We're going to have a one-on-one with Representative Small next week. We have Public Health Day confirmed for February 12th. Mark your calendar. Enlisting Lieutenant Governor and Senator Ben Lujan to give public remarks. Again, the 260 signatures in support of health councils. NMHC also is co-hosting a radio show called To Your Health. And this is where we love to engage our health councils. We want to give a megaphone to all of you to speak to the incredible work that you do, the impact that you're having in your communities. And we can use this as, collateral, marketing collateral, media that can help us in our marketing communications between now and leading and through the legislative session. So reach out, let me know when you have an hour, and also listen to some of the interviews that we've had as well. And really call to action to our health councils. We realize you're at capacity, if not beyond capacity, but whatever you can do to join the advocacy efforts, we're so grateful to all of you. We've had 2 media exposures as a result of presenting at Legislative Health and Human Services back in September. You'll have access here to an article published by Source New Mexico to the critical work of health councils and how this upcoming legislative session is either going to make or break this instrumental mechanism in public health called health councils. And I think it's important, if we have a little time, to watch our PSA video. This was made possible by a filmmaker here in Santa Fe, and the dedication of our team too. Very zero budget, lots of commitment. So I think it's important to share. It's just 3 minutes, but this will show what we've been up to. And this will be part of our awareness campaign. Sorry, my wife, I'm gonna take myself off of camera.
Leadership, whatever it is that we're.
Val, it is a little glitchy. Do you want me to
Please.
Okay.
My Wi-Fi.
Okay, I'm gonna share. So the sound should play too. Let's see. Okay. By chance, Rebecca, do you think you can play it? I'm so sorry. I am having trouble too.
Give me a second. I gotta pull it up.
I'll post it in the chat.
Let me give it one more try. Loading. Oh my goodness, really?
I think what's really great about health councils is
they serve as the liaison between community and state.
I stopped it. Sorry, I stopped it on my end. Go ahead. Go ahead, Rebecca.
Agencies, our community and elected officials or leadership. You know, whatever it is that we're trying to relay information to regarding community health and public health, that's what health councils are.
What we try to do is provide resources, provide information, direct folks to the things that they need. And it's not for us to decide what they need, but we are out there every day and we're talking to folks and we are building these relationships.
We have many problems that are not being addressed and that are not seen because they're in rural areas. So when people come to the food banks, when they come to secondhand clothing shops, when they come to walk-in clinics, they are presenting with some needs. And those are the needs that health councils can bring to the attention of elected officials.
Currently, health councils per county and tribal are currently being funded at $15,333. So when I think about public health infrastructure, when I think about the critical foundational role the health councils play in delivering public health, in conducting the community health-based assessments, conducting the community health improvement plans, implementing strategies, collaborating with partners in the public sector to deliver services to their local community members. To me, that seems a very obvious operational infrastructure to invest in. And currently in New Mexico, we're not doing that.
The issue that we know about health councils is that, and it's county and tribal health councils, that some of the cities and counties have the means to invest in our health councils, and some rely totally on state funds. So we, as a state legislature and as the executive branch, we need to step up and we need to make sure that the appropriate amount of funding goes into our health councils so they can plan for all the people in our state.
Take this opportunity to invest in our local communities, advance health equity by investing in our local health councils. This is the most obvious mechanism by which to streamline resources, programming, services, collaborations at the local level so that every New Mexican, 2.11 million New Mexicans, have access. Access is at the heart of ensuring equity.
Oops. Where did I go? My eyes. Okay.
Well, that was fantastic. What are we waiting for? Everybody
Hello, New Mexico government. And I just gotta say, and I say this, Geraldine hears this, my team, I am deeply humbled by the work of our health councils. Deeply humbled. And we are doing all that we can, knocking on every door, approaching this in every possible way to, allocate the resources that our health councils need, that our communities need, right? To ensure direct services. So, and then this is programs update. Anyway, so that's sort of like on the high level, my friends, advocacy efforts. The team has done an amazing job at keeping our advocacy webpage up to date with the greatest and latest news and advocacy tools and what is the ask, what is the value proposition here, so that we're speaking to the same unified messaging when it comes to enlisting elected officials. and the governor. I honestly, I want to amplify all of your voices. I think the public needs to hear directly from you and your community. So we do have that mechanism of that radio show. As soon as we're back online too, with our communications and marketing, you're going to see a lot more activity via social media, press releases, engaging the local channels, other radio stations, publications. So this is why it's so important for us to have your voices be centered in this advocacy effort of engaging, educating, and enlisting. So with that, I'll pause and turn to Geraldine and Rebecca and see if there's anything that I may have missed, and happy to answer any questions you may have too.
Nothing on my end, and I think we just open up to questions or comments from health councils. I don't see any, Val, but I think I can add one thing of something Val and I have been doing is receiving requests from health councils to present at their health council meetings in the next few months in preparation for the legislative session. So if that's something you're interested in, Tana from the Rio Arriba Health Council is what we're going to be presenting to hers next week. So if you also need that support and want us to elaborate or present this to your health council, we'd also be happy to be on your agenda as well. And Tana.
Hi, everybody. So nice to be able to join today. My question has to do with the fact that our health council was approached by a representative of the COG in Taos County, Amalio. I don't know if any of you know him. Maduno, I think is his last name. Really great guy. Anyway, he has offered to help us write an executive summary for the health council and start the process of asking for money from our senators and representatives from the legislative session coming up. So we started that process with him. Our executive committee of the health council started that. We've had 2 meetings with him. There seems to be different rumors out there around what money is allowed to come. So our health council is fiscally sponsored through a nonprofit, not through county, city, or educational institution. So it seems that capital outlay, that you need to put forth a capital outlay request form, and then the representative or senators are the one who say, okay, we can't use that money because that has to go through the county. Number one, that's my first question. Does that money have to go through county, city, or educational institution, or can it come to a nonprofit to get to the health council? Question number 1 of 2.
Susan, you want to take this one, my friend?
Yeah. Hi, Tana. Thanks. Great question. Capital outlay does generally have to go through a municipality or a county or a tribal government. So if it really is capital outlay, which is usually brick and mortar, it's usually planning a physical building or a road or infrastructure. In the past 2 years, representatives and senators have had junior funds. What it is when we have a surplus budget, the legislature can decide to give each senator and representative some discretionary funds that they can do what they wish. What we've heard is there will not be junior funds available this year, and junior funds are separate. It's a whole separate pot of money than capital outlay. And but just for your information, junior funds, what's requested through junior funds also has to go through a government entity or a designated entity like a COG is quasi-governmental. I think they can give funding through a COG, through a city, through a county, through a state agency, and in some cases directly through universities.
Okay, thank you, Susan. So
yes, it cannot go directly to a
question,
nonprofit.
Which was about junior money. So then there's no point in a health council seeking funding for a project through the state legislature if that health council is not fiscally sponsored by a municipality. Is that correct?
Or a county. In other
right.
words,
So
yeah.
County, city, educational institution. Okay, thank you.
Clarify the junior money point. The Department of Health can be that governmental body that the money flows through to a nonprofit. We've done that before, recently as of last year. So if you are a nonprofit and it comes true that junior money is available someday, that's the way that it flows, is through the Department of Health.
Okay, Diana, thank you. That leads to one more question. We were told to complete the capital outlay form to get on the radar for junior money.
We are actually having a presentation on capital outlay and how it might, it's actually from a health council member who's also part of a COG, director of a COG, who has vast experience on capital outlays. So she's gearing the Health Council Talk December 1st presentation to health councils in how health councils could actually tap into capital outlay funding. So, Tana, if you want to join that session, she may be able to answer your questions on capital outlay.
Okay, quick time check. It is 1:04, 4 minutes past 1. Any other last burning questions? And I did see Val's chat. So if any health councils or any of our partners out there have any ideas on how to, any feedback on any of our advocacy strategies, or you would like to join or learn how to be part of the efforts, please reach out to us and we'd be happy to follow up with you. So that concludes our Health Council's talk today, and thank you so much for taking the time to be with us this afternoon. I hope you all have a wonderful weekend.